I need to talk to you about something that's been bugging a lot of people. There's so much wrong information floating around about diabetes, and it's not just annoying, it's actually harmful. Because when people believe wrong things, they either panic about stuff that isn't true, or they miss the real warning signs that actually matter. Or worse, they feel ashamed about something they never should have felt ashamed about in the first place. So in this video, I'm going through the 4 biggest diabetes myths that people genuinely believe. And I'm going to tell you why exactly each one is wrong, what the actual truth is, and then I'm ending with what the research actually says you can do if you have diabetes or if you want to avoid it. Evidence-based stuff, not something made up on the internet. Now let's get into it. Hi, I'm Dr. Bernard, board-certified internal medicine physician. Before I get into the myths, I want to explain why this stuff actually matters. Because it's not just about correcting facts. When people believe wrong things about diabetes, a few things can happen. Some people feel like it's a punishment, like they did something wrong, and now they deserve it. That shame makes them less likely to go to the doctor, less likely to talk about it, and less likely to get help. And that silence is dangerous. Other people hear things like, just stop eating sugar and it goes away, and think it's just that simple. So when it doesn't go away, they think they failed. No, they haven't failed. The information was just wrong. And when there are people who have type 1 diabetes where diet has absolutely nothing to do with it, they still get told, you should have eaten better. That's just wrong. And that's also cruel because diet has nothing to do with type 1 diabetes. So here are 4 myths with real answers. Let's get into them. Myth 1. You got diabetes from eating too much sugar. This is probably the most common one and it's not completely made up. But that statement is just oversimplified in a way that does real damage. How does eating too much sugar fit into the picture? Here's how. When you eat foods high in sugar or refined carbohydrates, your blood sugar rises. In response, your pancreas releases insulin to help move that sugar out of your bloodstream and into your cells, where it's used for energy. If this happens once in a while, your body handles it beautifully. But if you are regularly eating more calories than your body needs, especially from sugar drinks and highly processed foods, you may gradually gain weight, particularly around your waist. Over time, that extra body fat, especially deep belly fat, causes your body to develop resistance to insulin. So although your body is producing insulin, your cells are resistant to it, and they stay locked. Insulin is no longer able to push the sugar from your blood into your cells efficiently. And what happens? The sugar stays high in your bloodstream. Think of insulin as someone knocking on a door. At first, your cells open the door right away, but over time, they start ignoring the knock. The pancreas tries to compensate by making more and more insulin, hoping the cells will respond. For a while, that works. But eventually, the pancreas can't keep up. There is no longer effective insulin that is enough to move the sugar into your cells. So what happens? Sugar begins to build up in your bloodstream. That's when your blood sugar level rises and type 2 diabetes can develop. So the problem isn't that sugar is poison. The problem is that years of excessive calorie intake with weight gain in susceptible individuals and insulin resistance can overwhelm the body's normal system for controlling blood sugar. And type 2 diabetes can develop as a combination of this. Type 2 diabetes develops because of a combination of things. Your genetics, your family history, how your body handles insulin, your hormones, your sleep, your stress level, or chronic inflammation. The WHO and the American Diabetes Association both make this clear. Diabetes is a complex condition, not a single cause with a single solution. And for people with type 1 diabetes, sugar has absolutely nothing to do with it. Type 1 diabetes is an autoimmune condition where your immune system attacks your own pancreas. No amount of eating better would have prevented it. So people who say otherwise are simply wrong. Myth 2. If you have diabetes, you can never eat carbs again. I understand why people think this. Carbs turn into glucose, glucose raises blood sugar, so cut the carbs, right? It's not that simple. Carbohydrates are in almost every healthy food. They are in fruits, in vegetables, in beans, in whole grains, even in lentils. These foods have fiber in there. And fiber is exactly what slows down how fast sugar enters your blood. So a bowl of oats and a spoonful of white sugar, they are completely different things, even though both are technically carbs. The American Diabetes Association Standard of Medical Care, which is the gold standard guide for diabetes treatment, does not say no carbs. It says choose higher quality carbohydrates with more fiber and less processing. This is a very different thing from cutting carbs out entirely. Completely eliminating carbs is not only unsustainable for most people, it can actually cause other problems long term. Myth 3. Fruit is basically sugar and diabetics should avoid it. Eating a whole apple is nothing like drinking apple juice, which is nothing like eating a candy bar. And that difference matters enormously. When you eat whole fruits, the fiber, the water content, the vitamins, all of that slows down how quickly the natural sugar gets absorbed into your blood. Your blood sugar doesn't spike the same way it does from processed sugar. Research consistently shows that eating certain whole fruit is not only safe, but it's actually highly beneficial for people managing diabetes. A massive study published in the BMJ tracked thousands of people and proved that eating certain whole fruits, especially things like apples, grapes, and blueberries, directly lowers your risk of diabetes complications. Another major trial showed that eating just 2 servings of whole fruits a day can slash diabetes risk by 36%. But here's the golden rule you cannot forget. It must be whole fruits, not fruit juice and not dried fruit, where the fiber has been removed and the sugar hits your blood much faster. When you eat a whole apple, it's packed with fiber. That fiber acts like a speed bump in your gut, slowing down your digestion and preventing a sudden blood sugar spike. If you strip that fiber away and turn it into fruit juice, you're basically left with a glass of fast absorbing liquid sugar that triggers a massive insulin spike. So put down the juice glass, grab the whole fruits, and let nature's packaging do the work for you. Myth 4. Only overweight people get type 2 diabetes. The research is clear on that, and I'm not going to pretend it isn't. But it's one of the factors among many, not like the only one, and definitely not a rule. There are people who look slim on the outside, but have fat stored in around their internal organs that you cannot see. Doctors call that visceral fat. And that type of fat is metabolically active in a way that promotes insulin resistance, meaning someone can have completely normal body weight and still develop type 2 diabetes. Simple. It happens. And the reverse is true too. There are people who are overweight who never develop diabetes because their genetics and metabolism work differently. So you cannot look at someone and know whether they have diabetes or are at risk of diabetes, which is exactly why testing matters, not just assumption, not judgment, but testing your blood sugar. So we've cleared out the bad information. Let me tell you what actually works, because the research here is genuinely encouraging, and I think more people need to hear it. For type 2 diabetes, lifestyle changes are powerful in a way that's unusual for chronic conditions. A 10-minute walk after meals has been shown in multiple studies to meaningfully reduce blood sugar spikes because your muscles actually use glucose directly when you move. You don't need to run a marathon, just walk after dinner. Eating more fiber, more vegetables, more legumes like beans and lentils, more whole grains, slows how fast glucose hits your body in a way that genuinely matters. Not a complete diet overall, just more of the right stuff. Sleep. People really underestimate this one. Research has shown that even partial sleep deprivation, just a few nights of poor sleep, impairs how your body uses insulin. It raises your stress hormones and disrupts your blood sugar regulation and increases your cravings. So 7 to 9 hours of sleep is not a luxury. It's literally how your body metabolism repairs itself. And here's an interesting research to note. In a clinical trial called the DiRECT trial, published in The Lancet in 2018, people with type 2 diabetes went through a structured weight loss program. And at 1 year, 46% of them achieved remission, meaning blood sugar went back to normal. And this was without medication. At 2 years, 36% of them were still in remission. That study changed how a lot of doctors think about what's actually possible. Remission isn't guaranteed for everyone, and it's more achievable in earlier stage type 2 diabetes. But the point is, it's a documented, real possibility. And that's worth knowing. And if you need medication, take it. Some of the newer medications for diabetes, they don't just control your blood sugar, they also protect your heart and your kidney at the same time. Using the tools available to look after your health is not giving up. It's smart. So if you need to be on medication, then take the medication. So, 4 myths cleared up and some actual research backed things that genuinely move the needle. The big thing I want you to take away from this is diabetes is not a punishment. It's not a personal failure. It's not a life sentence either. It's a condition that when you understand it properly, is far more manageable than the myths would have you believe. If you haven't seen my previous video where I go through what diabetes actually is and how the 3 types work and all the early warning signs, go watch that next. The link is right here. Drop a comment which myth surprised you most, or has someone ever said one of these things to you? I genuinely want to know. Subscribe to my channel for more informative videos about important health topics. Hit the like button and share this video with someone who needs it. And I'll see you in the next one.